Welcome to Healing with Heart. Simple ideas for profound healing. These videos are meant for informational purposes only, not intended to diagnose or treat medical conditions.
Hey guys, Dr. Martin Hart here. I wanted to wrap up the Hidden Infections in Your Face series today with ear infections. We could have a 5-second debate on whether or not the ears are actually on your face or not, but we're just going to skip that, okay? A lot of my patients deal with ear infections, congestion in the ears, hearing loss, balance issues due to inner ear issues. And so it's important for us to take time to look at that and deal with those to help improve quality of life and not miss something. But what I find on a regular basis is that ear infections are usually secondary. There may be a primary infection in the mouth or dental health. There may be infection of the sinuses that's draining back. Maybe there's food allergies that's creating mucus that's congesting the tube. So there's eustachian tube structural deficit. I found all sorts of things like patients with Lyme disease creating mucus in the inner ear. I've seen the lymph nodes swell and push fluid back into those regions. All sorts of different aspects. But what's important is if you're dealing with those inner ear infections, if you're dealing with constant ear problems, congestion, swimmer's ear, all of that, it's important that you look further, okay? Don't just dismiss it, take a few antibiotics, put some antibiotic drops, and let it go out of your mind. My recommendation is you take time to look a little deeper. What's an infection that may be going on that's driving that's a little deeper? Is there a food that you need to eliminate or cut out, or a digestive issue that you need to deal with to look further? Now, there are a few things that I found that help with chronic ear infections. Draining the area with some lymphatic drainage techniques, just like that, from the back of the mastoid down to the SCM region, and just helping to drain that spot can be a big help. There's various chiropractic techniques that you can have a qualified chiropractor do. The ear adjustment down and out to stretch and open that eustachian tube to allow drainage. Warm liquids to encourage drainage. Drainers, herbs, things that promote movement of lymphatics and fluid, like bitters and things like that, consuming those. Ginger can all be a big help. They're going to thin the mucus and get it to move. And then just, of course, dealing with the underlying cause. So if you're dealing with some of those inner ear issues, the motion issues, you're dealing with congestion, chronic ear infections, things like that, take a look deeper. And then maybe below, put down what you've done if you've had ear issues and how you've dealt with it, and then share this video with whoever you think would be helpful. Take care.